You have the floor for 6 minutes. Thank you.
Thank you, Mr. Chair, and I want to thank all of the witnesses for their important testimony and for the work they do. Dr. Hyshka, you talked about the need for the federal government to declare a national public health emergency, something that the NDP has also been calling for. And we saw the federal government recently, they just hosted a summit on auto theft. But they haven't done anything like that on this crisis. And you talked about you've lost more lives in Alberta due to the toxic drug crisis than you did to COVID. Yet we saw the spending and the effort from the federal government is less than 1% of what they've spent in terms of responding to the toxic drug crisis than they have COVID. Do you believe the federal government is doing enough in terms of rolling out a plan with a timeline and resources? And what do you believe is necessary to respond to this crisis in the short term?
Yeah, I don't want to get bogged down in debates over the specific legal mechanisms of declaring an emergency or not, but I think obviously we need to recognize this for what it is, a public health emergency, and we need to substantially increase federal spending. And I think we also need to not only do that, but look at currently 60%, almost 60% of federal spending for the Controlled Drug and Substances Strategy is going towards law enforcement efforts. And I think we need to be looking to see if that is getting us the best value for money in terms of improved population health outcomes. We are not resourcing enough provincially or federally, social programs, healthcare, and a whole host of other options that can potentially be more effective at supporting people to stay alive and achieve recovery and get well. Beyond that, I think in the short term, there's a lot of things the federal government could do immediately to try to bring down the death rate. First and foremost, please do not cut the existing funding to safer supply programs. We know from evidence from different treatment studies as well as emerging safer supply evidence that if you abruptly cut people off their prescription medications, they're at a much higher risk of death. So just sustaining that funding, continuing to innovate in that area to look for more effective solutions, including non-prescriber models of safer supply. We just had a study published on the Compassion Club in BC that showed very early but promising results in terms of reducing mortality. Beyond that, I think we could be looking to improve safer supply programs by working with pharmaceutical companies and regulators to identify medications that are going to more effectively meet people's needs, potentially reducing the risk for diversion. Beyond that, I think we really need to look at a national project around decriminalization. You know, I can't think of a stronger form of stigma than criminalizing someone. And we talk a lot about needing to end stigma, but then we continue to criminalize people for their health conditions. In BC, there is a imperfect decriminalization pilot happening. I think we need to have a national conversation about what this would look like across the country. And we need to first and foremost and permanently say this is a health issue. We need to stop criminalizing people, and that needs to happen across the country. It's not fair that people who use drugs in BC are potentially not subject to criminal charges, but everywhere else they are. I would also like to see an overhaul of the SUAP program. I think the way that the investments are currently made is not as effective as it could be. And I think we need to be looking at ongoing operational funding for evidence-based services as part of a core suite of options for people across the country. And I think federal funding could play a huge role in ensuring equitable access to treatment across the provinces, equitable access to safer consumption services, and other really proven interventions. I also want to highlight too, and I'm not sure the committee has heard this evidence, but we know in Alberta and BC that the majority of people who die from drug poisoning are dying after smoking drugs. And yet supervised consumption services across the country, very few of them actually allow people to smoke drugs within them. And so a pretty quick change that could happen is for the federal government to subsidize supervised consumption services to make the renovations required to be able to accommodate supervised inhalation. And I think that would have an ancillary benefit of bringing more of the public drug use that is a concern across the country due to a whole host of factors, including a lack of housing. But it would bring that public drug use inside. And certainly this is a big issue in Edmonton, where I'm from. Many people are smoking drugs outside of supervised consumption sites because they cannot smoke them inside. And if they go down and have an overdose, they know the staff will run outside to help them. That's not an effective way to respond to a crisis. And it's something that could be addressed pretty quickly in the short term. And I think it would save lives.